Welcome to our video on sporotrichosis. Let's get started. We're going to discuss definition, clinical features, diagnosis, and management of sporotrichosis. Sporotrichosis is a fungal infection caused by Sporothrix schenckii. It is transmitted through inoculation of fungus into the skin, for example, via a thorn. Sporothrix is associated with activities like landscaping and rose gardening. Under the microscope, Sporothrix appears as oval to cigar-shaped yeasts. Let's talk about clinical features of lymphocutaneous sporotrichosis, which is the most common manifestation of sporotrichosis. Symptoms appear days to weeks after exposure. First, a papule at the site of inoculation appears, which may ulcerate later. Then, proximal lesions along lymphatic channels develop, which is called nodular lymphangitis. There are no systemic symptoms. Let's see this image of a patient diagnosed with sporotrichosis. It shows the ulcerative lesions that develop along lymphatic channels. Now let's move on to the diagnosis and management. Clinical findings are highly suggestive. Microscopy can be used. Cultures of specimens are the gold standard to confirm diagnosis. Oral itraconazole is used for management. Amphotericin B should alternatively be used in disseminated disease and for pregnant patients. Let's end this lecture with a question. A 32-year-old man presents to the clinic due to several bumps on his arm. He states that the first of these bumps appeared on his forearm, but they seem to be spreading up his arm. When asked about his occupation, he mentions that he is in the landscaping business and has recently been working long hours planting a rose garden around the town hall building. On physical exam, many nodules are seen to be coursing up the arm following the lymphatic channels. If a biopsy is taken and placed under the microscope, what is most likely to be seen? A. Yeasts with broad-based budding. B. Cigar-shaped yeasts. C. Spherules filled with endospores. Or D. Captain's wheel formation. So this 32-year-old man presents with several bumps on his arm, which turn out to be nodules following the lymphatic channels of the arm. In this case, nodules are seen coursing up the arm following the lymphatic channels. And this presentation shows nodular lymphangitis, with the inoculation site being the first of these bumps appearing on his forearm. Additionally, this patient is in the landscaping business and has been recently around many rose bushes, such as planting a rose garden. This patient's history of rose gardening plus his clinical presentation of nodular lymphangitis should make you think of lymphocutaneous sporotrichosis caused by the fungi Sporothrix schenckii. Under the microscope, Sporothrix schenckii shows oval or cigar-shaped yeasts, making answer choice B the correct answer. Here is a microscopic slide that shows the oval to cigar-shaped yeasts of Sporothrix. Now let's discuss the other answers. Answer choice A is incorrect because yeast with broad-based budding is a microscopic finding indicative of blastomyces dermatitidis. Answer choice C is incorrect because spherules filled with endospores is a microscopic finding indicative of Coccidioides immitis. Answer choice D is incorrect because captain's wheel formation is a microscopic finding indicative of Paracoccidioides species. And that concludes this section.